Diabetes and heart disease. Today we're going to talk about diabetes and how it affects the heart if you do not keep it controlled. Diabetes is a very livable disease, but the key to that is keeping it controlled. Heart disease and stroke are the #1 causes of death and disability among people that have type 2 diabetes. And at least 65% of the people with diabetes die from some part of heart disease or stroke. Adults with diabetes are 2 to 4 times more likely to have heart disease or a stroke than adults that don't have diabetes. The American Heart Association does consider diabetes to be one of the 6 major controllable risk factors for heart disease. So again, it's on what life choices are you going to make as far as your diet and exercise to control the diabetes. Now there's 2 types of diabetes, and so I'm going to briefly describe what those are, because I've found that in cardiac rehab a lot of people know they're a type 1 or type 2 but really don't understand what that means. Type 1, you're usually diagnosed at a younger age. Usually it is in childhood or early adulthood. And what that means is your pancreas does not work. It is not secreting the insulin into your body to control your blood sugars as we eat. So since your pancreas is not secreting that insulin, you have to take insulin in a shot form. Type 2, your pancreas is working and it is secreting the insulin, but your body is resistant to that insulin. It is not using it properly. So usually when you're first diagnosed as a type 2, you start in pill form, and then if they can't get you controlled, or the older we get, they may add insulin down the road. Some people never have to go on insulin, some do. Now what they have found with type 2 is the #1 cause of type 2 is obesity. And they have found that if people lose weight and exercise, that type 2 diabetes could go away. And so with children, they're really stressing that, because in America, we're very spoiled, and we go through, because children are so active, they have a lot of activities in school and sports, and we take them through the drive-thrus because it's quick, it's fast, and we can get them to all their activities. And we're finding there's a major obesity problem in America, and especially with children. And I did tell you type 1 is usually diagnosed in childhood, but they are finding there's getting to be a large proportion of children that are type 2 diabetics, and it's caused by their obesity. Complications of type 2 diabetes is very significant to death due to heart disease and blindness, kidney disease. These patients go on dialysis, neuropathy that's caused, nerve damage, and circulation problems that end up causing some amputation. Heart disease, stroke, high blood pressure, and circulation problems are the most important or most major causes of morbidity and mortality or death. What they have found is not only is your diet important on diabetes, but exercise is huge. Exercise makes your body use the insulin properly so we can control the blood sugars. It improves the blood glucose management, and it definitely reduces the risk of heart disease and the other complications that happens, because exercise again will lower your cholesterol, lower your blood pressure. Exercise can prevent type 2 diabetes or possibly delay type 2 for, if it's going to hit you, it may not hit you till later in life. So exercise is important, and the minimum is 3 to 5 times a week, 30 to 60 minutes. Glucose does come from the breakdown of your food, and food and glucose is our energy, and that we use to continue to go every day and have the energy that we need to do to continue to live life every day. But we have to keep that glucose under control, and that's where the insulin in our body is very important. If you have high blood sugars over any length of time, it damages our vital organs, again, our eyes, our kidneys, our heart, all the nerves. So you get a lot of bad complications. What's important for you guys to understand is signs and symptoms of when am I need to be concerned if I might have diabetes. And I have found that a lot of heart patients have never been explained what are signs and symptoms of a high sugar or a low sugar. A type 1 diabetic usually, has weight loss. You have increased urination, you're up all night and you're peeing all night long, you cannot get enough to drink, you are thirsty all the time, you're hungry all the time, and even though you're hungry all the time, you're still losing weight. You get fatigue, blurry vision, headaches, and you become very irritable. A type 2, also you have increased urination, you're up peeing all night, you're thirsty, you're hungry, but you get frequent urinary tract infections, especially in women, numbness and tingling in your feet and hands, a lot of itching, and men have problems with impotence. So those are some signs and symptoms of diabetes. It's important to know signs and symptoms of ketoacidosis, and that is when your blood sugar is extremely high. And there's not a magic number for ketoacidosis. Some people are already peeing ketones in their urine at a level of 500, and someone else might not have any ketones in their urine until it's like 1,000. But ketoacidosis can be deadly. So it's very important to keep those blood sugars under control. It can start with nausea and vomiting and just generalized abdominal pain. You can't understand why. You're dehydrated. You're breathing very shallow and very quick. You become drowsy. Your heart rate's going fast, but you're found to have a low blood pressure. And the most important thing is when someone is in ketoacidosis, if you ask someone to take a just breathe in your face, you'll smell a fruity odor. It's like juicy fruit gum. And when you smell that fruity smell on their breath, then you know they're usually in ketoacidosis. But you can go into a coma and die from ketoacidosis. You do end up in the hospital, and hopefully we can turn it around rapidly if we do find you in it. Diet. I don't get specific with your diet because everybody's been diagnosed with diabetes at different times in their life, and as the American Diabetic Association and American Heart Association continues their research, the diet changes. Some people, back in the 80s when I first started in nursing, people were taught calories depending on how much you weighed, what your height was, etc. You were given how many calories you were supposed to take in a day. Then it changed to carb counting, and some people are carb counting. And then it changed to 6 small meals a day. Well, now they've taken the 6 small meals away and want you to do 3 regular meals and no snacks. And then they're also just teaching normal portion size. So there's different ways. So I tell you all, you will learn through the dietitian here what the recommendations are, but I tell you to talk to the dietitian and your diabetic doctor and follow that diet. But what the most important thing on your diet is eating regular. A diabetic cannot skip a meal. A lot of diabetics have it in their head, if I don't eat, then my blood sugars will stay low, when in reality that is not true. When you don't eat, you're stressing your body. Stress puts not eating puts too much stress on your body, and your blood sugars go high. You cannot eat. And one of the worst things, some people think it's all about high sugars or all about low sugars. Well, when your sugars go up, down, up, down, up, down, that's what's actually worse on your body. We need to keep your blood sugars more regular. So even though 140 is too high, we'd rather see you steadily at 140 than go to 200 to 110 to 60 to 200 and go all over like that. So you must eat regular meals and about the same time every day. If you're eating all over the place, you can't get your blood sugars regulated. Some good choices for snacks is nuts and peanut butter, but it is all about the amount, and you will learn the serving sizes from dietitian or your diabetic educator nurse. You have to eat a lot of fibers. Fruits and vegetables, where the fibers come from. Vegetables you're okay with, but the fruits, diabetics do have to watch because of the natural sugar that's in there, and they will make your sugars go high. We want you to eat the fruits, but a normal serving size for a diabetic on a fruit is not the same as someone non-diabetic. It is important to keep a log and do your finger sticks, because when you're dropping low, you need to know, and you need to know it's time to take a snack in what you've been taught to eat. Now, as far as diabetes and exercise, as you know, coming into cardiac rehab, we are sticking your finger before you exercise and after you exercise, because what exercise is doing is helping your body use the insulin in your body and break down that glucose. So your sugars will usually come down. Now, some people's blood sugar at the end of exercise, when we stick you may initially see that it goes up. You might have come in at 225 and it went up to 250 after exercise. Some of that is just caused from the stress hormones from the exercise, but in the next hour, hour and a half, your sugars will start coming down. But the majority of people, if you came in at 150, you'll see it below that, maybe 120 after exercise. And your sugars continue to drop for at least 1 hour to an hour and a half after you're done exercise. So it's important for us to know the beginning of what your blood sugars are. And what our protocol is designed on is if you're only on pills or if you're on insulin. If your sugar is below 100, we're going to have to snack you depending on what you ate before you came in and how much insulin you took. We usually have you keep your insulin the same until we see how your body's going to react and what your blood sugars are doing. But what I have found, people that are on regular insulin that take it 3 times a day with their meals, if you're coming in a morning class or right after lunch, sometimes the doctor has you either decrease that regular insulin, or we have you not take that regular insulin on your Monday, Wednesday, Friday because you dropped too low. But we have to see how your body's going to react. So those first 3 sessions help give us that idea, and then we contact your doctor and see how they want to manage that. It is important to eat before you exercise, especially cardiac rehab, but anytime you're going to exercise outside, you need to make sure you eat because of what it does. If you are low, if you are below that 100, you need to take 15 grams or 1 carbohydrate in. And people that have been taught carbohydrates are taught what that is. If there is a list of some examples on your last page that I'll talk about in a minute. If you're just going to do a light exercise, then you only need 1 carb. But if you're going to do more intense or strenuous activity or a harder exercise, you need to take 2 carbs in if you're below 100. But if your sugar does drop just low, not because you're exercising, but just drops after you eat 1 carb. A lot of you are taught just to drink 4 ounces of orange juice. Some are peanut butter and crackers. But you have to wait a full 15 minutes after you've completed that snack, if it be juice or peanut butter and crackers, before you recheck your blood sugar. Some of you have the glucose tabs, and they teach you how to use that. Here in cardiac rehab, if you are on insulin and you drop 70, if your blood sugar after exercise is 70 or below, we have to give you the tablets to get it up quicker. The most important thing is, though, if you are at home and you're using juice or some candy, you must eat a meal that has protein in it, so something dairy or meat, within an hour, because anything quick like juice that brings your sugar up quick, it burns off very quick and your sugar will drop again. So within an hour of that juice, you need to eat something that has protein in it. It is important for every diabetic to always carry some type of snack. A lot are taught to carry hard candy. Chocolate's not the best because it melts in the cars or in your pocket. So hard candy in case your sugar drops. Have juice around. Peanut butter and milk, they're both protein, so they're good to get that sugar up fast, as well as because it is protein, it'll last longer versus drop very quickly. It is important for you not to exercise if your blood sugar is above 300. If it's above 300, why you're told not to exercise, even though yes, exercise brings it down, is because it can break down muscle, and your heart is a muscle, and a problem or complication you can end up with is what's called rhabdomyolysis. And when you pee a color that looks like iced tea, there's a good chance you might have rhabdomyolysis, and that is potentially life-threatening, and you are hospitalized. So you never exercise above 300. Now, we have exercised people here with a sugar of above 300, but we have certain protocol. One, if they're on insulin, if they have symptoms, if they don't have symptoms, and what we do with our protocol. But at home, since you don't have guidelines to follow, if it's above 300, you do not exercise. And if it stays above 300, you need to contact your doctor. It's very important to drink water before, during, and after exercise, because exercise does dehydrate you. And so you need to get hydrated, because dehydration can also affect those blood sugars. And I'm sure you've all been taught that have had diabetes for any length of time. Inspect your feet on a daily basis. You do not go barefoot because neuropathy, which means you lose nerve ending feeling, you can cut your foot, get a bad infection, and diabetics don't fight off infection the way I fight off infection. So it's important not to go barefoot and look at your feet on a regular basis. And then on the last page is some examples of 15-gram carbohydrate snacks that are good that you can carry in the car, throw in your purse, or if your sugar drops at home. And I'm not going to go through that list, you can look at it, but those are good examples of some snacks for when your sugar is low, or if you need a boost up before exercise.